Hello. So my name is Ahan, and I'll be interviewing you today. So my first question is, what is the most promising technological or clinical innovation in oncology recently adopted in India, and how it can improve access or outcomes of patient in an under-resourced area?
Okay, no, this is a complex thing to ask specifically. Under resourced. In general, most of our population is under resourced. Probably the biggest challenge we have is a financial thing and logistic thing, which means patients have to travel long distance to get optimal results. And that is probably the biggest reason of dropouts because leaving their livelihoods, going to faraway places becomes a problem. So probably what best is happening right now in the last 5 years or so is brooming of the centers in far off places in B town, C town areas where the access to patients have increased a lot. I personally have seen that many patients who had just given up on their treatments and all probably are now at least going for treatments. We need a little more awareness to let them know that the results would be better if they come to us early. Okay, they are reaching, but mostly at the late stages. But yes, in the B town, C town, we need to encourage, we need to aware patients. Not only that, initially it was the concentration of our technologies was only restricted to the larger cities, but now if I am a radiation oncologist, I can quote on that technologies like IMRT, IGRT, SBRTs, these are all available now, coming up in smaller areas. The thing is the skill should also move there, okay, so as to ensure a perfect balance. There is lot of research in medicines, drugs, which still are expensive, coming under some DPC controls and all, where we have a more affordable structure, we have better surgical skills, more controlled. So it's not a one thing which I can quote you that which has brought a revolution or something. I think it's the entire thing. More and more people aware, getting aware probably would be the sole biggest determinant of bringing our mortalities down.
So circling back to the dropouts, so what would you think would be the biggest bridge in the gap in order to stop the dropouts, also while making the treatment and the medicines for cancer much more affordable for the general population?
Uh, as I said, probably the biggest hurdle was a logistics, leaving away their livelihoods, their working. Every time a patient moves to a place, he takes some eligible working adult with him, which means the workforce is reduced at his own place. Okay, so more and more centers coming in the peripheries, in B towns and C towns, has ensured that it has become more accessible to them. Okay, more and more private, government was always covering the smaller areas, but yes, they have their own constraints and limitations and all. More and more private partners in the healthcare are reaching into the periphery to bring in more technologies, and we that has actually ensured that the dropouts are less. Second is your question about the expenses they spend on the drugs and all. The government definitely have a lot of schemes we have discussed. There are CSR initiatives. Probably the patient people are not aware of. They reach those CSR things and then it happens. There are government schemes, the Ayushman Bharat scheme, the state fundings. They should avail whatever possible things they have. And obviously the government is doing every effort to cut down the prices and all. Thank you.